So let's talk about hematomas after breast surgery of any type. So bleeding after surgery is a relatively common complication. It's one of the standard complications that you will see on your paperwork for probably every procedure you will ever have. Bleeding in breast surgery is typically 5-ish% or less of patients, but it certainly happens. So bruising after surgery is relatively common and different than what a hematoma is. A hematoma is a little bleeding collection that's in a little clump like this. So instead of just having some blood throughout the tissue causing a bruise you can see through your skin, it's a little collection that's often deeper. So sometimes you won't even see discoloration of the skin. You'll just notice that that side is bigger. And there's lots of different ways to manage hematomas. So right after you bleed, your blood clots, and it's a thick, kind of almost gelatinous mixture, almost like, I hate using food analogies, but kind of like a jelly. And it's a little bit difficult to remove. You can't just put a needle in and withdraw it because it's so thick it won't come out easily. So if you want to remove a hematoma right after surgery, you really need to go back to surgery or do a minor procedure to remove that collection. So if your hematoma, especially if it's sizable, your surgeon will take you back to the operating room. It doesn't have to happen emergently. As long as the bleeding happens and stops, you can wait a day or two or sometimes even longer. The main risk of waiting too long is that it could alter your results. It can stretch things and do something weird to the way that you look, and you may not have the result you want long term. Now, another option is if you have a hematoma and you don't want to go back to the operating room, you certainly can just wait for your body to start dissolving that clot and for the blood to become liquid again. And it can be removed that way with a needle and syringe, or sometimes just putting a little tiny drain in. So it's a way of managing a hematoma in a non-surgical way. I would not recommend doing this for a larger hematoma. This is something that's appropriate if it's small. And then the final option is just to leave it alone. So depending on the surgery, this may be a totally appropriate option. If it's not horribly big, you just leave it alone and your body will absorb it with time. If you're not concerned it's going to alter your cosmetic results and there's no implant in place, you can certainly do that. Now, if there's an implant in place, I always recommend removing blood around the implant, and it's often best to do it as soon as possible because there's something called a hematoma contracture. So if you leave bleeding around an implant, even a smallish hematoma, the process of dissolving that blood and getting rid of it is inflammatory and sometimes can make a tight, bizarre capsule around your implant and can lead to a contracture. So if there's an implant in place with breast surgery with a hematoma, I think it's always best to remove that blood. And then finally, I just want to mention something called an expanding hematoma. So usually if you bleed after surgery, a little clot pops off your blood vessel at some point. It's usually like anywhere from 4 to 8 hours after surgery when your blood pressure starts to come up a little bit, you're in a little bit of pain, and then you bleed and it stops. But occasionally it happens a little bit different and it's a little scarier. So it's always important, if you're concerned about a hematoma, you let your surgeon know right away. An expanding hematoma is where you develop bleeding after surgery and it doesn't just bleed a little and stop. It just keeps going. And so you end up with your breast getting bigger and bigger and bigger and bigger because the bleeding is not stopping. And that is a more dangerous situation, and that's something that, of course, you go in as soon as possible to stop it. So hopefully that little review of hematomas in the breast answered your question. Let me know if you have any more.